The Community Analysis of Largo Presentation by Jamie Miller at St. Petersburg College. Historical overview of the Largo community. In the 1500s, the Timucua Indians settled in the Pinellas County area. They built homes and harvested cornfields to trade with the tribes in the north. The first permanent non-native settler was in 1823. In the 1800s, more family settlers came to the area: the Taylors, McMullins, Wilcoxes, and Belchers. Largo became the center of the area's citrus industry. In 1905, Largo was officially incorporated and became the first town in Florida in 1913. Railroads were brought to Florida in the 1950s and allowed the population to grow over the next 10 years. In 1962, an unexpected freeze demolished Largo's agriculture industry. Developers came in and built more homes for the growing population. Today, Largo is a community of more than 70,000 residents and is continuing to grow, becoming known as the City of Development and Advancement. Analysis of the structure of the Largo community consists of healthcare facilities, food commodities, transportation, places of worship, and recreational parks and amenities. The community of Largo structurally meets the needs of the community compared to the surrounding communities of Seminole and Clearwater. They are all equal in comparison and are providing all of the amenities appropriate for the residents in each community. The issues and concerns observed in relation to the structure of the community is the amount of accessible fast food restaurants. This can cause early obesity in young children and type 2 diabetes. Analysis of the population of the Largo community. From research and data collection, an observed population issue in the Largo community is the percentage of unemployment. Statistics show Largo's population of employment to be 53.3%, making the population of unemployment 46.7%. Health concerns in the Largo community involves bacterial STD rates higher among women ages 15 to 34 years old. In comparison, the STD and HIV risk factors among U.S. young adults are higher in sexual minority women in each racial and ethnic group. Since local results are similar to national results, young women need better education related to sexual activity and risk factors for developing an STD. The Largo community could start by developing more informative programs and begin visiting and educating the young grade school students at the local schools. Analysis of adequacy of health-related resources and availability in Largo. For healthcare, the Largo community has access to the local hospital, Largo Medical Center. Accountable primary care clinics and walk-in clinics include JSA Medical Group and MedExpress Urgent Care. Affordable, free, and income-based clinics in Largo are community health centers of Pinellas, Inc. and Mid-County Health Department, Pinellas County Health Department of Largo. For nutrition, there is easy access to a variety of grocery stores from Publix's, Walmart's, a Target, and Safeway. An affordable food bank for families in need of assistance is the Religious Community Services Food Bank. For physical activity, Largo has John S. Taylor Park, and recreation facilities include the popular Highland Recreation Complex and LA Fitness locations. Healthy People 2020 has a number of outcome measures for health-related issue concerns. The 3 goals of Largo community could benefit from is preventative health screenings, immunizations for adults and children, and HIV and STD awareness programs. The Largo community's #1 leading cause of death is cancer. The increase of preventative health screenings will include mammograms for breast cancer screening, colonoscopies and fecal occult blood tests for colon cancer screening, and PAP and HPV tests for cervical cancer screening. Immunization stats show kindergarten children fully immunized at 89.9%, and adults who received the flu shot is 40.2%. Education of importance of vaccination and providing free flu shots can prevent the possibility of an infectious outbreak. Largo needs improved awareness programs on sexual health taught at local schools, clinics, and community events to decrease the rate of HIV and STD spread. Analysis of the environment. Adequacy of the environmental resources in the Largo community include the William E. Dunn Water Reclamation Facility, who is recognized by the Florida Department of Environmental Protection, and the South Cross Bayou Water Reclamation Facility that treats wastewater with a 4-step water cleaning process. The water testing results after the process shows 99.9% clean for drinking. Pinellas County has one of the most innovative waste management systems in the U.S. They are known for their recycling programs. Pinellas County was acknowledged for having the highest recycling rate in all of Florida. Environment issues and concerns in Largo were perceived in the Community Windshield Survey and observed littering in the streets, parking lots, and apartment complexes, such as cigarette butts, styrofoam cups, and paper and plastic wrappers. The City of Largo Commission meeting mentioned the pollution in the Long Branch Creek waterway. Samples and testing showed fecal coliform bacteria and general coliform bacteria. The plan to reduce the amount of bacterial contamination in the waterway is to provide more pet waste disposal stations in the area and reduce grass clippings by educating lawn service companies and residents. Analysis of government and public policy. Largo City Commission meetings are scheduled on the first and third Tuesday of each month. Budget funds provide all aspects from wastewater, solid waste, stormwater, construction, and community redevelopment. Largo Police Department is available 24/7. Largo Fire Rescue is the 3rd busiest fire department in Pinellas County, required to provide a minimum of 15 firefighters on a fire call within 9 minutes and 20 seconds. They receive more than 73 phone calls for help every 24 hours. The areas of concern in the Largo community is the crime rate. The number of crimes reported for 2017 to date is already 465 crimes. Police response time over the years has increased tremendously. The City of Largo Police Department has a program called the Problem-Oriented Police Unit to train officers in problem-solving approaches to crime prevention and reduction. The Largo City Commissioners and Mayor need to provide more funds to this program and hire more officers to decrease the response time to an emergency. Overall community needs, problems, and community diagnosis of Largo are listed in this order due to health being a priority. 1 is cancer being the #1 leading cause of death. 2 is reported STDs, high rates in women ages 15 to 34. 3 is Zika virus affecting Florida residents since 2016. 4 is family living in below poverty level, high percentage of 21%. 5 is pollution reported bacteria in waterways, and 6 is violence of number of crimes increasing. Global community issue. Zika virus is a mosquito-borne virus started in Uganda and has been reported in every region of the world, including the state of Florida. Zika virus infection is associated to health outcomes related to Guillain-Barré syndrome and fetal abnormalities such as microcephaly, a neurological disorder. Global actions include support mosquito control programs, providing mosquito nets, and posting travel notices and other travel-related guidance. Local actions include Pinellas County mosquito control experts treating known breeding areas on ground and in the air. Rick Scott has asked the Centers for Disease Control and Prevention to rush 1,000 Zika testing kits to Florida. Education prevention includes wearing clothing to cover up skin, bug repellent, and decreasing areas with standing water. A Largo community nurse can focus on finding speakers and educating prevention at every local event. Thank you for listening to the community analysis presentation of Largo. I hope you enjoyed.